Can we please talk about the hard things? I'm Martha Van Dam, and this is Living Beyond. And this is Breast Cancer Awareness Month. I'm using this for Inflammatory Breast Cancer Awareness Month because that's the specific type of breast cancer I had. It is an orphaned cancer. It is talked about very rarely, and it doesn't act like other breast cancers. It doesn't show up that way. It is not recognizable in 90% of cases through mammogram. We need to know about, and we need to spread the word about this type of cancer. But our topic today is when your patient has cancer, your patient has questions and thoughts that may be very, very difficult. They may be hard things about, am I going to live or die? What might death look like for me if I die from this cancer? I'm scared I won't be here to raise my children. What if I die? Is my spouse, my husband, my wife, are they going to remarry and will I be forgotten? If I have to have a mastectomy, will my husband stay around? Will he stay will he stay when I only have one or no breast? These are hard questions that cancer patients face. And they don't just come up every now and again. Those are the questions that sometimes we live with. And yet very often, because our culture pretties things up so well, and our culture has a real difficult time really dealing sometimes with the hard and ugly truths of life, sometimes those of us with cancer find it very, very difficult to talk about the hard things. If you are the patient, my message to you is you find your people and you talk about those hard things. Don't you hold them in. And if your people, if your family and your friends, if your family and friends just can't hear it, then find a counselor, a pastor, a priest, a cancer coach, a life coach. Find someone who can hear those things and who can bounce those things back and forth with you. If you're having the thoughts and you're having the concerns, you need to be able to talk about them. To my friends who do not have cancer, but who maybe love someone who does, can you challenge yourself to be really uncomfortable, but to stick in it when your person has hard things and difficult things they want to talk about? If they're concerned about, is this cancer going to kill me? Your first response might be, no, well, we don't even want to think like that. No, we're going to think positive. But what you do when you do that is you shut them down. And you say, this thing that you're worried about, oh no, we're not talking about it. You just keep that one to yourself, Missy. I don't want to bear the weight of that. That's what you're saying with that response. It is not easy. I will grant you that. But I will also say, if the person in front of you can deal with cancer and the potential of dying and the potential of all the things that treatment brings and the potential of their life changing in the major way that they are facing it, if they can deal with that, then you can sit with them and be a little uncomfortable while you hear them talk about it. We have a major problem among breast cancer, inflammatory breast cancer patients. We often don't have people we can talk to about the hard things. We need you to listen. We need you to sit with us when we ask the hard questions, and we need you not to shut us down. We need you not to try to give us a quick, pretty answer. We need you to sit with us in the discomfort of our fears and our concerns, the hard questions. Death, losing our children, our spouse leaving us, and it does happen. We need someone who will sit with us as we talk about those things. Please be there for someone.